Good morning, good afternoon, good evening to everyone joining us from around the world. Gareth Presh, founder, CEO of the World Health Innovation Summit and CEO of the Global Social Prescribing Alliance. And I'm going to introduce you to my colleague who we've just had a chat about his announcement here and his second name. He's from Norwegian, Thailand. So I'll let David introduce himself. David, please introduce yourself to the audience.
Thank you very much, Gareth. Very happy to be here and talk with everyone. My name is David Yttervik Sithiang. I work as head of humanitarian programs and preparedness here at the Hordaland Red Cross branch in Western Norway, in the city of Bergen.
Fantastic, David. So for those who are joining us, we're going to have an update. We launched the National Social Prescribing Group in Norway in September. And what I'll do initially is I'll give a sort of overview of the Global Social Prescribing Alliance and how we're establishing these national groups, and give you a broader context. And then David will take a deep dive into sort of the case studies, how things are mobilizing, how we're growing, shall we say, the alliances work with the National Social Prescribing Group, with colleagues in Norway. And then by all means, if you have any questions, please pop them in the chat. We'll have a slight Q&A at the end of this. And then we'll also speak to some colleagues from Portugal who will give us an insight into the sort of work that they're doing around social prescribing so that we have an international context. And I hope you enjoy this webinar. By all means, just sit back for the next 25, 30 minutes, get a cup of coffee, cup of tea, and enjoy. And any questions you may have, just fire them to myself and David, and we'll bring them up on the screen and we'll do our best to answer them. So let me kick it off. I'll just bring my presentation up, which is basically about the National Social Prescribing Group in Norway and the Global Social Prescribing Alliance and the work that we've been doing. So firstly, just give you some background. 2021, we launched the UK, the Secretary of State launched the Global Social Prescribing Alliance, and the alliance was set up to champion the global shift towards prevention-focused, person-centered healthcare. I mean, this really came from a conversation myself and James Sanderson had over a Zoom. In 2020, we discussed how we could align social prescribing with the work we were doing with the World Health Innovation Summit. And it really has taken off over the last couple of years. I've spent a lot of time with James. We've put a lot of effort into, mobilizing the global community. And we're beginning to see the fruits of that activity now. Just for people who are tuning in who may not understand social prescribing, I just thought I'd just touch on it. So it's a holistic approach connecting people to non-clinical community services. And I'll also share this presentation so people have it afterwards. You can get access to it. I'll put it up on LinkedIn. But you can see the types of social prescribing: green, blue, arts, physical activity. I know David's going to go into some detail around the actual case studies and how it's working in Norway. Social and community, mental health and well-being, work and skills. And I think work and skills are very important as we build out the infrastructure for social prescribing. That's part of our work. We've published a number of papers this week. And then, of course, you need practical support. And how do we bring this all together? So I just wanted to sort of show you what the global community is doing, just so that you have some wider context. And so we have like a community of practice where we have international community practice implementation champions, and we have them all over the world now. We're in excess of 40 countries at the moment. We're doing research and academia links, workforce development and policy. Last year, we hosted an online event, which was the Global Social Prescribing Summit in 2025, which we had over around 2,000 people from 40 odd countries. We had a session earlier this year hosted at the Radical Health Festival, which is focused on social prescribing. We have also set up, as I said, our policy research and academia with the likes of Professor Jill Litt. And we're connecting and supporting change makers all over the world. So it really is a global movement, which is starting to gather big momentum. The story so far, so myself and James and with other colleagues at the WHO and other international agencies across the UK and across the world, we've been really championing this, working hard. I spent a lot of time on the road, spoken at the World Urban Forum, been to Geneva, met colleagues at Campus Biotech, for example. James had a fantastic presentation with the Minister for Loneliness from Japan. We've had events in London. I've went to the UN General Assembly to discuss it with colleagues in the States. We put a lot of work. I had a fantastic visit with the ICLI group, in Adunga. I've done some training in Indonesia. We went to COP, published some books, launched in Italy, spoken about it at the COP as well in terms of climate and health, the opportunities for green social prescribing. And then last year, very unfortunate enough to work as well as an advisory member to the Radical Health Festival, and I spoke about social prescribing on occasions when I was invited to speak there. New publications and assets which you can download now, and I would encourage you to take a look at them. So we have obviously the social prescribing playbook, and we have artificial intelligence and digital health and social prescribing, which will move quite quickly. I think that will play a huge role in the adoption of social prescribing. The social prescribing student movement is open now. So if you're out there in countries and you want to set up your own movement around social prescribing as a student, by all means, reach out, download the assets. And probably one of the most important thing is about how do we mobilize the finance? And that's one of the things we're doing as a group with the Global Social Prescribing Alliance. It's bridging into capital and the capital markets. And how do we convince governments and stakeholders, investors to put money into sort of bonds and create new funding structures. So we published a paper, Prevention as an Investable Asset Class. Please, by all means, take a look at that and, reach out to me if you have any questions on any of these. So now the National Social Prescribing Group, it's under the auspice of GSPA. What we want to do is transform healthcare beyond medicine. So vision, thriving communities, driving a social revolution in health and well-being. And our mission really is to advance social prescribing globally through collaboration, innovation, and advocacy aligned with SDG 3. The aims, a community of practice, which we're growing, as I mentioned, spread and adoption. David's going to give us some real insights into how that works in Norway. International evidence, collaborative. That's very important that we bring all this learning back centrally and then disseminate it across the peer-reviewed journals. And the key principles. So redefining health, clinical leadership, very important in this space. Community development, building blocks, ensuring that arts, nature, exercise, knowledge are all connected in. Workforce solutions. So very important that we create new and meaningful jobs. The UK has invested over 400 million into creating over 3,000 new jobs in the UK. So we want to adopt that and share that. I'm having discussions with colleagues over the world. Digital innovation will play a huge role. How do we make this all seamlessly happen using the technology that we have? Impact, social prescribing types, as I mentioned. I think I've touched on this. I won't go into too much more detail because I'm conscious of time. Context, community-based solutions, improve well-being, sustainable healthcare is critical, and global best practice. So it's very important that we disseminate the best practices that we have across the patch and make sure then everyone locally can learn. Purpose of the National Social Prescribing Group in Norway and around the world will be that it's advanced social prescribing, collaborative platform. I will say collaborative platform, but we also need that commitment because it's important that partners commit to what we're doing. And then we will look at accessing global funding and bring, stakeholders, investors, bridge into the capital markets. And we want to also act as a unified national consortium for project delivery. So we can consolidate the projects and go as one voice so that we can raise the capital. Strategic objectives, of course, population health, which will, of course, improve economic outcomes, cross-sector, work with the public-private sectors, academics, be a platform that's innovative, look at innovative financing, social impact bonds, outcome-based contracts. There's a lot of work going on in the UK that can be shared as best practice. Standards and evidence ensure that the patients and communities are getting value for money, and that the practices are at the highest standards and aligned to the UN Sustainable Development Goals. The memberships, so we will be, we'll have at each national group, we'll have a membership sort of formula, and it'll be open to healthcare, government bodies, academics, community organizations, and private sector partners. So, each member commits to collaboration, active participation, national project delivery, and a minimum of 3 years as part of the group. So the governance structure that we've set up is have chairs, co-chairs, steering committee, secretariat, and also working groups. I think the working groups will feed into the overall structure. And then, of course, all this information can be disseminated at our national and global conference every year. And what we will do is ultimately bring this to every country and allow and have, you know, input from national entities to be able to host these events all over the world. Global governance, just so that everyone's clear on our sort of structure, because we're a community interest company in the UK, and we have the Global Alliance with national groups. So they go from, everyone has an equal share in this partnership. I'm just going to finish with a couple of final notes because I'm conscious of the time. I've slightly gone over. You know, please join us in transforming healthcare. You know, we've got Social Prescribing Day coming up, 26th of March. Mark your calendars. And we've also set the date for our Global Social Prescribing Day in 27th of March, because we're going to move from a weekday to a Saturday so that we can incorporate more activities at the weekend. Just final note from me, I just want to say thank you for joining us. I hope this has been informative. If you have any questions, please pop them in the chat. Join us for the Global Social Prescribing Summit. It's the world's largest social prescribing event, and it's a fast-growing global market, as we mentioned. Social prescribing student movement, please get involved, and all our policy papers are available to download now. I will stop the share. I hope that was informative, and I will hand over to my good friend David. And David, the floor is yours, and looking forward to learning about the exciting work that you've been doing in Norway.
Thank you very much, Gareth. Can you still hear me?
Can do. Go ahead.
Great, thank you. Yeah, so I'm grateful for this opportunity to speak about the social prescribing pilot that we have in Norway, both to an international and a Norwegian audience. I'll just get my presentation going here. Let's see.
There you go.
There we are. Okay, so this social prescribing in Norway, or social resept as we call it, it's a collaborative pilot, or it's two parallel projects actually. It's a small scale pilot as well as research on that pilot at the same time. The Norwegian Social Prescribing pilot has a strong focus on volunteerism, even stronger than in some other models, I think. And we even to some extent have link workers as volunteers in our model that we're trying out. We're adapting social prescribing to the Norwegian context, and we have a strong history in Norway for very good cooperation between the government and NGOs, especially when it comes to search and rescue, where the Red Cross is very active as well. And we're modeling some of the project based on experiences from that side. We see loneliness as a major catalyst for negative health impacts, and social prescribing as a preventative tool in that context. Our pilot, as I said, is coupled with a research project. And this pilot will teach us about what outcomes we can get, as well as how we can scale for a future big-scale pilot that we are planning. So two parallel projects here on the west coast in Bergen, Norway. The small-scale pilots by Hordaland Red Cross, which is a region of the Norwegian Red Cross. And then there's a social prescribing pilot feasibility study, and it's conducted by the Western Norway University of Applied Sciences. And it's led by Roger Ekeberg Henriksen, who is well known in the research field. Our funding comes from the Foundation DAM, which is a foundation that receives part of the profit from the National Lottery in Norway. And they support projects in voluntary humanitarian organizations in preventative care, rehabilitation, and research. So both the pilots as well as the research project is actually funded by this foundation. And just briefly, the project timeline, we've been working on this in the Red Cross here in Hordaland since 2018. and the pilot were launched last year, or a little bit more than a year ago. So far, we're learning a lot, and our target group and the people that we meet in our pilot are people with a limited social network, people who are isolated, they experience sudden disease. It's people who are falling out of or have fallen out of the workforce, psychological challenges, and we see people in vulnerable situations who are in need of preventive action so they do not become isolated. The experience so far in our pilot is that we're reaching a target group that the Red Cross normally do not reach. And the cooperation with health workers is working well, but we also need more visibility with GPs, and I believe that's also an issue in other places, and we're keen to learn about others' experiences there. We're learning that flexibility in the volunteer role is important, and also linking the right volunteer with the right person. We have had quite some media coverage in national news outlets, and one of the articles from here is about Roger, who is in charge of the research at the Western Norway University of Applied Sciences. And here's his contact information if you're interested to learn more about the research that is going on. This is a feasibility study conducted on our pilot, and we're eager to learn about the results of this research, and I think it will teach us a lot about how we can conduct a large-scale pilot in Norway in not too far a future, we hope. Here is some more information about how loneliness can be connected with social prescribing. And here's just, I'm not going to spend a lot of time on this, but this is more details about the ongoing feasibility study and how it works. Of course, anybody interested in more details about this parallel project to our pilot is very welcome to contact Roger and his colleagues. So basically, as many people might know, social prescribing, the patients, they get a social prescription from a GP or a social worker, and then they get connected with the Red Cross, with our project lead, and they interview the participant, and they also get a request to join this study. And the whole pilot is scaled towards the study, because we want to recruit the right number of people to join the study. Then the participants, they are followed up for more or less 12 weeks, sometimes shorter, sometimes longer. Some of the participants are interviewed, and after 6 months, there's a second questionnaire, and then after 12 months, there's another questionnaire. And then there's also interviews with volunteers, GPs, health workers, and project staff about experiences in the project. So social prescribing is something new in Norway. We're the first pilot of this method. As I mentioned, we have received some attention, and here's an article from the Norwegian version, you could say, of the BBC. And it says that the Norwegian government is in the process of assessing social prescribing, and of course we're very eager to see how that process goes, and of course we are hopeful that this will show us future models of how to finance some of the social prescribing. So here is some key figures about our social prescribing pilots as of today. More than 30 social prescriptions, about 30 volunteers, and we have 28 GPs as part of the project from 6 medical centers. and also 12 health workers from the university hospital here in Bergen. And as I said, the study is to recruit enough participants to the study. And going forward, the Norwegian Social Prescribing Group, as Gareth mentioned, was launched in September. And the social prescribing pilot is now set to join the group. And of course, we're looking for partners and supporters who can help enable a big scale pilot from 2027 and onwards. And we see this network as an interesting arena to examine future possibilities of funding structures. So that's a short introduction to the work that we've done so far. And of course, I'm happy to take comments and questions from Gareth or from the audience as well, of course.
Fantastic, David. So let me just pause for a minute. We have I have a couple of questions anyway around the next steps and sort of like your future plans. But let me bring in Cristina Vaz de Almeida from Portugal, just to give us some context from what they're doing in Portugal and also the links that we can make to Norway.
Hello, my name is Cristina Vaz de Almeida, and I am the president of Portuguese Society of Health Literacy. First of all, I want to thank to the CEO of WHIS, Gareth Presch, for this kind invitation to participate in this important event of Norwegian Social Prescribing Group. We know that health literacy is a cornerstone of effective social prescribing because it enables people to access, understand, and use health information and services to make informed decisions about their well-being. And social prescribing goes behind medical treatment. It connects individuals with community resources such as physical activity programs, social participation, initiatives, and community support networks that promote holistic health. For social prescribing to reach its full potential, however, people need competencies that allow them to interpret information, evaluate options, and apply recommendations in their daily lives. This is where health literacy becomes essential. It empowers individuals to engage actively in their care and to adopt healthier behaviors with confidence and autonomy. Investment in physical activity is especially relevant within this framework. Physical activity is an evidence-based intervention that improves physical and mental health, promotes social inclusion, and reduces the burden of chronic diseases. For young people, it helps build lifelong healthy choices and habits and strengthens resilience. But for people who live with chronic diseases, including cancer, a structured and adapted physical activity improves the quality of life, supports recovery, and contributes to better long-term outcome. We have a very good experience with a program named From Steps to Hugs to Physical Activity to Elder People with Cancer, and very good results within the social prescribing. So societal investment in accessible physical activity programs represent a strategic investment in public health and in social sustainability. At the same time, health literacy must also prepare populations to face the emerging global challenges, including extreme climate events, heat waves, floods, wildfires, and other climate-related risks, increasingly affecting health and daily life decisions. Providing people with competences to understand warnings, assess risks, and adopt protective behaviors is essential to prevention and safety. Health literacy enables individuals and communities to make informed decisions that protect themselves and others, especially the most vulnerable groups. In Portugal, we also work with the Council of Portuguese Council for Health and Environment. We are member and founders. The Portuguese Society of Health Literacy plays a critical role in this effort to promote education, awareness, and community engagement. So by integrating health literacy into social prescribing and by investing in several areas as physical activity and climate-related health education, we can empower citizens, reduce inequalities, and build safer, healthier, and more resilient communities. In conclusion, strengthening health literacy is not simple an educational strategies. It's a social investment. We have also participated in Helsinki in the festival of Radical Health Festival with our program, and we look forward to cooperate also with Norway. I wish in my name, in the name of Portuguese Society of Health Literacy, that all the best to Norway, and we look forward to working together. Thank you very much. Thank you, Garrett Presh.
Fabulous message from Christina there, David. Gives you some context of the sort of global movement. Of course, Portuguese-speaking countries have a vast network around the world, as you're aware of. But just some reflections on what she said there. I'm conscious we've got about 5 minutes left. If anyone has a question that you want to put to me and David, please, by all means, pop it in the chat. Now is the time. But I hope this has been informative. But David, your reflections.
Yeah, very interesting to hear about the movement in Portugal as well. I think this is one of the great opportunities of joining the international network is that we can build our own network and we can learn from others' experiences as well, and hopefully there are some experiences from our project that can also inspire other projects in other countries. And of course, both of those are reasons for us to join international networks at this stage.
Yeah, and I think also it gives you, you talked about the finance, and I think it's very important that we recognize that we need to work together to raise the capital. And I think the Alliance can be that voice to work with investors to bring in those new innovative financial models, which we've been working on for many, many years. Over the last 3 years, I've spent a lot of time and investment trying to bridge into the financial sector to understand how we can structure these funding structures so that local communities can benefit. So we've got a lot of knowledge, we've got a lot of know-how now acquired. Now is time to bring the communities together so that we can execute. And also, I think we have to inform investors and family offices, high net worth individuals. Very important. And ultimately, all of these new initiatives and services are an opportunity to reduce costs. So we know we have proven evidence in the UK for every pound invested, you get at least £3 back. So there's no reason not to scale that up so the government can make those savings. And we can set up funding structures so investors can put the money in. You can have outcome-based contracts. You can speak to the private sector. So this is an enormous opportunity, David. And also for colleagues who are listening in around the world, we are, launching this in the US and all over the world. We've had conversations this week in Argentina, in Colombia. We're talking to Asia. We've been speaking to small nation states in the likes of Vanuatu, around the South Pacific. So and of course the Commonwealth states as well. There's a lot of opportunity here, and we launched today our Irish initiative as well. So, I think we're now beginning to see the fruits of many, many years of hard work. I've been involved in this for 25 years. It takes a long time to get to this stage, but I do believe we're now beginning to mobilize and work with colleagues who share the same vision. And it's an enormous opportunity because the health sector is under so much pressure. The UK, for example, the economic burden on the exchequer, for example, you have 2.8 million people with ill health. It's costing nearly 100 billion annually. It's about 7% GDP. That impacts the chancellor's fiscal policy, you know, when she goes to borrow money. So ultimately that means the NHS services get cut. So we really need to address this quite quickly. Social prescribing is a great lever for that. It can help us immensely. So let's get on with it. Let's start to mobilize our local communities. I will hand over to David for some final words and final thoughts. I know we're on this journey together. It's a long process. But David, please, and I think we may have a comment as well in.
Yeah, comment from David John Kerr.
Yeah. Go ahead. I can bring it up. Hold on. Yeah, I think he's working with me in Ireland, so it's fabulous stuff. So, yeah, thanks, David. Amazing work. Thank you, and delighted you could join us. But David, some final words of wisdom just before we wrap up.
Yeah, it's I just have to say that it's been very interesting to initiate this project back in 2018, and then finding social prescribing on the international arena, and trying to fund a pilot here in the west of Norway, and now finally starting to see the pilot in action working, and we're starting to see some of the similar results from elsewhere around the world. And of course, I think it's especially exciting that we have this parallel research going on at the same time, which I think will also, be important to give confidence to the government and other funders as well for supporting social prescribing in the future. So yeah, Gareth, just thankful for an opportunity to talk with a wider audience. And thank you very much.
Yep. And for anyone who's just joined in, this will be recorded. We'll disseminate it. We'll share it with our networks. By all means, please take a look at the website, www.whis.world/GSPA. You'll find all the information there. Myself and David will be no doubt planning and plotting further webinars as we gather momentum over the next couple of months. Don't forget the next month, we've got March 26th, the Global the Social Prescribing Day, which is on a Thursday this year. And to get involved, by all means, take a look at the website. All the information is there. And then the final thing, just to say, this year we have our global conference, which will be virtual, which will be online. As I said, this year will be online, but next year we're in the process of planning where we will establish this. Probably we'll be in a country. We'll pick a location. We're looking at various cities at the moment. Potentially, could be Oslo. You don't know. Could be Bergen. By all means, David. It could be an opportunity for us to go to Norway. But I hope that you've enjoyed this session, and we'll wrap this up. So from myself and David, thank you very much for joining us, and looking forward to working with you all as we deliver social prescribing on a firstly local level, national, and then a global level. And collectively we can achieve that and deliver health for all. So thanks very much, David, and audience. We'll end the stream. Thank you.